Hello and welcome to our Dr. Skeletal Medical channel. Here we discuss about various medical issues. The topic for today's discussion is pulsus paradoxus. Definition: what does pulsus paradoxus means? It is an exaggerated fall in patient's blood pressure during inspiration by greater than 10 mm of Hg. Mechanism: during inspiration, the lungs expand, leading to chest wall expansion and diaphragm pulling down. This creates an intrathoracic negative pressure, which then acts as a suction. Continuing the mechanism, negative pressure or the suction helps us to pull the air inside our lungs during inspiration. Along with air, even the blood from the peripheral region gets sucked in, and the blood gets pumped in the pulmonary vessel that helps us on gaseous exchange process. Not just lungs, even the heart feel this suction, especially superior and inferior vena cava. The blood gets pulled in and poured into right atrium. From right atrium through tricuspid valve, it goes into right ventricle, and right ventricle is slightly overfilled, and it tends to expand in all dimensions, also in the septum, giving less space to the left heart side. That is why during inspiration, left side is slightly less filled. Since during inspiration our left ventricle is slightly underfilled, it triggers a series of events like in-diastolic volume decreases. This leads to in-diastolic pressure decreases. This leads to myocardial stress decreases. This leads to contractility decreases. That leads to stroke volume decreases. That leads to cardiac output decreases. And then overall systolic blood pressure is decreases. As long as this decrease in systolic blood pressure is around 10 mm of Hg, it's normal. It's normal physiology. But if it exceeds more than 10 mm of Hg, then it's called pulsus paradoxus. During normal circumstances, this decrease in 10 mm of Hg pressure cannot be palpated. Rather, we can observe it by Sphygmomanometer. Let's discuss about some pathology here. We all know that the heart is covered by a pericardial layer. It has 30 to 50 ml of fluid in it in normal circumstances. It has its own specific function, like it helps reduce friction during heart systole and diastole, and it also works as a shock absorber during any external trauma. But in the case of cardiac tamponade and other some similar issues, the right ventricle cannot expand in all directions as pericardial fluid extend pressure, so it further pushes septum towards the left, giving even less space for left ventricle. Since our left ventricle is severely underfilled, it triggers the same series of events but more aggressively. Like in-diastolic volume decreases severely, that leads to decrease in diastolic pressure, leads to decrease in myocardial stress, that leads to decrease in contractility, that leads to severely decrease in stroke volume, that decreases the cardiac output. Now, systolic blood pressure falls more than 10 mm of Hg. That's what we know as pulsus paradoxus. What are the causes of pulsus paradoxus? We have cardiac cause like cardiac tamponade and constructive pericarditis. We have non-cardiac cause like asthma, COPD, pulmonary embolism, and even obstructive sleep apnea. We have non-pericardial cause like restrictive cardiomyopathy, like right ventricular myocardial infarction. We have other causes like hypovolemic shock and even marked obesity. Before going any further, let's discuss what cardiac tamponade actually is. It is a life-threatening condition in which a pericardial effusion has developed so rapidly and largely that it compresses the heart, leading to decrease in ventricular filling and cardiac output. We can even see in this picture. Continuing with cardiac tamponade, what are its causes? The most common cause of cardiac tamponade is aortic aneurysm. Yet we have some other causes as well, like advanced lung cancer, like acute pericarditis, heart attack and heart surgery, even external chest injury, especially stab wound. Treatment: in order to treat any disease, first we must focus on the underlying cause. The main cause of pulsus paradox is cardiac tamponade. Now, to take care of cardiac tamponade, we have a particular procedure called pericardiocentosis. It is a procedure done to remove the excess fluid filled in the pericardium. To perform this procedure, we need a needle and a long thin catheter. If you find our content useful, to consider to like, share, and subscribe to our Dr. Skeleton Medical channel. Thank you.